Okay, well, good afternoon, everyone. Again, my name is Stewart, and I'm with Midwest Financial Group. We are located in Madison. We're actually right on the South Belt line at the Seminole Highway exit of in Madison. It's our main office. We do also have an office over on the east side, right off of Highway 151. Kind of behind the car dealerships over there. So that's where we're located as far as our Madison locations. And I do want to thank you today for joining me for this Medicare educational seminar. A couple of things on the bottom of your screen, there should be a chat button that if you hover over it, you can ask questions by typing them in to the chat portion of that, and I will be able to see your questions and answer them as we wrap things up today. So Medicare, of course, can be confusing, and hopefully with the information I present today, it'll give you some clarity as far as what the journey is going to be like joining Medicare and signing up for Medicare. What is original Medicare? And then what's the difference between a Medicare supplement or a Medigap plan and a Medicare Advantage plan? So we're not going to talk about plans today or pricing for plans, things like that, but kind of give you the basic information in order to have some knowledge about what is Medicare and to be able to make an educated decision as things progress towards your Medicare start date. So for the first part of this presentation, I'm going to do a screen share and a short PowerPoint slideshow to kind of go over signing up for Medicare. So let me pull that up here for us. Okay, so signing up for Medicare, and if you're 65 or going to be 65 in the next 3 months, it's a good time to sign up for Medicare. You need to sign up for Part A, hospitalization, and Part B, the medical insurance portions of Medicare. And now, if you've already started your Social Security, so if you're getting Social Security benefit payments, then you will automatically get your Medicare card in the mail. It should come, typically people are saying about 3.5 months prior to your initial month you begin Medicare. So you always begin Medicare on the first of the month of your birth month. Unless your birthday is on the first of the month, then you get it the start of the month prior to your birth month. And so when can you sign up? As we've been talking about, your initial enrollment period prior to turning 65 or 8 months after turning 65. And then there's the general enrollment period and another period called a special enrollment period. So there are different things that go on in people's lives that some are ready to sign up, others are not ready to sign up, especially if they're still working or a spouse is still working and has coverage through a employer group plan. So initial enrollment period, 7 months. You have 3 months prior to your birth month, the month of your birth, and then the 3 months after that. And signing up prior to, of course, your Medicare would start the month that you turn 65. If you sign up during the month you turn 65, it would start the first of the month after, and so on for the next 3 months after that. So Mary turns 65 in April. She signs up in April for a May 1st start date. She's good to go. Signs up in May. So she turned 65 in April, but signs up in May. It'd be 2 months later, so she would start in July. And then again, signs up in June. So she's 2 months after. It would be September 1st, which would be 3 months. And then signs up in July, October 1st, 3 months after that, as you can see on the screen there. If you know you're going to be starting Medicare, it's much better to start and to sign up prior to the month you turn 65. The general enrollment period. So if you miss your initial enrollment period to sign up, every year there is a general enrollment period. And that's from January 1st to March 31st, as you can see. Then your coverage doesn't begin until July 1st of that year. So if you know you're going to need Medicare and are not eligible for a special election period, that's kind of the scenario that you have to work with, is the general election period. If you fall into the general election period sign-up point, you may have a late enrollment penalty assessed to your Part B premium. I'll cover the Part B premium when we talk about Medicare and what is original Medicare. So if you don't get Part B when first eligible, your monthly premium may go up. And as you can see, 10% for each 12-month period you've had Part B. You could have had Part B but didn't sign up for it. And then you pay for it for the rest of your life. So always a good idea to get signed up early and take advantage of the benefits and not have to pay premiums. Another example there of a late enrollment penalty. Not going to read through there, but I'll give you a second here to take a look at that. Now the special enrollment period. Some people, I talked to actually quite a few people that fall into this. You can sign up for Part A or B anytime as long as you or your spouse are covered and you're both covered under an employer group plan. So your employer, if you're on an employer group plan, such as the school district's plan, you don't have to sign up for Medicare, both Parts A and B, when you are turning 65. You also may have an 8-month special enrollment period to sign up that starts when one of these times, whichever happens first, the first of the month after employment ends, or the month after group health plan insurance based on current employee ends. Pretty self-explanatory there. Usually you don't have to pay a late enrollment penalty because you've had coverage. So the key to that is having credible coverage, especially credible coverage for prescription drugs. Most plans have that. The ones that you'd have to be concerned about is if you are on a high deductible health savings account plan. So the employer, the plan administrator from your employer should be able to provide a notice that indicates that your current coverage on your group plan is credible coverage. So those are some keywords to look for in employer group plans. Even if you elect COBRA, so if you or your spouse leave the group plan offers COBRA typically for 18 months after you end employment. You need to sign up for Medicare. COBRA does not replace Medicare in that situation. You need to sign up for Medicare in order to avoid having to sign up during the general election period and may have a late enrollment penalty assessed on your Part B premium. So delaying enrollment, if you're working, covered under employer group coverage, you may enroll in Medicare Part A and or Part B, depending on the size of the employer. Where this comes into play is small employers. As you can see on the screen, employers with less than 20 employees, Medicare actually comes first, and the group plan plays a secondary role. Over 20 employees, such as the school district, the district plan is first, Medicare plays a secondary, so that the group plan takes care of all the claims. Medicare is not involved when you're on a employer group plan with over 20 employees on it. You can still sign up for Medicare Part A when you turn 65. You just do not need to enroll in Medicare Part B and start paying the Part B premium on a monthly basis, because the group plan, again, is your primary coverage for insurance. Again, what we just covered there, 20 or more employees. If you are taking your Social Security payments on a monthly basis and you get the Medicare card in the mail automatically, as I stated earlier, you can actually send it back and say, there's a section on it where you can deny or delay enrollment in Medicare Part B for a time period. Again, larger employer, over 20 employees, you don't need both Medicare Part A and Medicare Part B. So if you do receive if you or your spouse is drawing Social Security, you receive your Medicare card in the mail, and you want to delay paying for and taking Medicare Part B, sign off on that form, you send it back. Medicare will actually send you a new card with just Medicare Part A listed on it, with a start date for your Medicare Part A coverage would be listed on it. Delaying enrollment, when you're already enrolled in Medicare, you need to complete some forms here. As you can see, enrolling in Medicare can be done online through the Social Security Administration's website. And if you search ssa.gov, it takes you to the Social Security website. You find the drop down for Medicare, and it walks you through the process of how to enroll in Medicare. And that's, again, done through the Social Security office. Another way, you can call Social Security. Since the pandemic began last year, they do not do in-person visit or appointments at Social Security. So what you do is you call in and you make a phone call in, and they schedule a callback appointment for you. People that I've talked to that have done that have told me it's a good long wait to get through to talk to somebody to schedule your appointment. Some have said 45 minutes to an hour on the phone, waiting on hold, waiting for somebody to pick up on the other side. The people that have done that have also said that the callback appointments are very timely. If they say they're going to call you at 10:15 on Friday, they're calling you at 10:15 on Friday. So that's one of the nice things about that. Part A, if you delay enrollment, your start dates for Part A can be backdated 6 months from the date you sign up, but of course not any earlier than your 65th birthday. Mentioned earlier, health savings accounts. If you are contributing to a health savings account, you will want to stop those contributions 6 months prior to turning or signing up for Medicare, turning 65 or signing up for Medicare. You may be penalized. There's some tax rules, so check with your tax accountant to find out more about that. But the general rule is 6 months prior to signing up for Medicare. If you're on an HSA medical plan and are going to be starting Medicare, you definitely want to stop those HSA contributions. Again, I'm not a tax professional, so I can't offer advice on that, but Medicare recommends that, so just wanted to pass that along. Part B, if you sign up while you have group coverage or during the first full month that you no longer have this coverage, you can choose to have the first of the month you sign up or any of the months, 3 months following. So you can actually choose your date. If you're retiring in June, end of the school year, but your group insurance covers you till the end of August, of course, you'll want to sign up so your Medicare coverage begins September 1st if you are already 65 years old. So if you sign up during any of the remaining 7 months of your SEP, coverage begins the first of the month after you sign up. So it's always recommended to, if you sign up in June for September 1st, you'll have your card. Your plans can be, your Medicare plan can be discussed, and you have plenty of time where there's no stress in August trying to figure out which way you're going to go with Medicare and what plan you want and things like that. So again, we'll save questions for the end. I will stop the screen share and we'll move on to what is Medicare. So original Medicare was actually began in 1965, signed into law by President Johnson. President Truman actually was the one that brought it up and got it going as far as a federal program, but he wasn't able to sign it into law. It actually started when President Johnson was in office, and he signed it into law. Coincidentally, Henry Truman was the first Medicare recipient. So just a little trivia from Medicare. Original Medicare consists of 2 parts. Medicare Part A, as we've been talking about, and Medicare Part B. So what are they? Medicare Part A is hospitalization. So you're an inpatient. Easy way to remember it, if your head is in a bed, you're under Part A. So it covers you as an inpatient in a hospital. It covers you in a skilled nursing facility. That's not long-term care. That's short-term, long-term, or skilled nursing facility. Inpatient psych hospital, and also hospice is covered under Part A. What they cover is pretty much your room and board. Medicare says they'll cover you for a semi-private room, if there is such thing anymore. They cover a general nursing staff. They cover the equipment that's in the room, food, cleaning crew, things like that. So under Medicare Part A, most people have earned Medicare Part A with no monthly premium by working for 10 years, or what's called, Medicare calls 40 quarters. Medicare Part A has a deductible for when you are admitted to the hospital. So under Medicare, original Medicare, under Part A, if you're admitted to the hospital, there is a deductible of $1,484 for this year, for 2021. That covers the first 60 days that you're an inpatient. If you're in there longer than 60 days, from days 61 through 90, it's a per day fee of $371. If you're in a hospital for longer than 90 days, you have what's called a lifetime reserve of 50 days. And that would take you from 60-day lifetime reserve, take you from day 91 through 150. The daily fee for days 91 through 150 is $742 per day. So that's why there's plans available, because if something happens and you're in the hospital, you don't want to pay those type of charges. Medicare Part B. Medicare Part B covers medical. On your card, it'll say Part A hospital, and then it'll have a start date, and then Part B medical, and the start date will be on your red, white, and blue Medicare card. So what Part B of Medicare covers is your doctors. So whether you're inpatient in the hospital or outpatient at a clinic, it covers things like labs, blood draws or any kind of lab work that you have done, imaging, x-rays, MRIs, CTs, that type of thing, therapy, whether it's physical therapy, occupational, cardiac rehab, pulmonary rehab, any of those type of things are covered by under Part B. Tests, and then durable medical equipment, things like home oxygen, wheelchairs or walkers, CPAP supplies, all fall under the durable medical equipment portion of the Part B of Medicare. Part B of Medicare has a monthly premium. So this year, 2021, the standard monthly premium for Medicare Part B is $148.50. If you are drawing Social Security, it's automatically deducted from your Social Security payment on a monthly basis. If you're not drawing Social Security, Medicare will send you a bill. You can pay it monthly. Some people pay it quarterly. there's different options as far as paying your Part B premium. So you have to keep paying the Part B premium even when you're on a Medicare plan, insurance type of plan. So that Part B premium is a constant. Under Medicare Part B, there's also a Medicare Part B deductible. The deductible for 2021 is $203. So 203 is the Part B deductible for this year. Once you pay your Part B deductible, then Medicare pays 80% of your billing and sends the rest, the 20%, to you to be covered under original Medicare. Medicare does not have a cap on how much your 20% contribution to the bills can be. So you can imagine if you are admitted to the hospital, you have labs, you have an MRI or a CT, you might need a surgery. So you have the general hospitalist doctor, you have a radiologist reading the MRI or CT, and then of course a surgeon, an anesthesiologist. It just keeps building from there. So those bills can add up pretty quickly. It's not uncommon for somebody to be in the hospital if they're there for a surgery and find out what's wrong, have a surgery. $100,000 is not uncommon for a hospital bill. Medicare pays 80%, sends you 20, the bill for 20% under original Medicare. That's the reason there are Medicare plans. So once you have your original Medicare, the Medicare card is actually a red, white, and blue card. So if I refer to it as your red, white, and blue card, that's because it has those colors on the card. The old Medicare cards used to actually have your Social Security number on it with a letter A or B at the end. In 2018, they started to replace those, and by the end of 2019, all of those had been replaced for people already on Medicare, and all new cards coming out do not use your Social Security number as your Medicare card number. Of course, that didn't go over too well with people that were, with the identity theft and other things that have become more numerous in recent years. So what about the types of plans that help cover what Medicare doesn't cover? There's pretty much two avenues you can take. The first avenue is what we call a Medicare supplement or a Medigap plan. Those two names are interchangeable. They mean the same thing. Medicare supplements and Medigap plans are plans that cover what Medicare doesn't cover. You may have seen advertising, or if you talk to a friend or relative that live in another state that it's on Medicare, they might tell you that they are on a Medicare Plan F, and I don't pay anything for my Medicare. They live in a group of 47 states that use those lettered plans. Here in Wisconsin, we don't. There's 3 states, Wisconsin, Minnesota, and Massachusetts, that don't use the lettered plans as 47 other states do in the country. What we use here in Wisconsin is what's called a base plan. And for people that are turning 65 after January 1st of 2020, there are 4 riders that are available to add to your base plan. Pretty simply, the base plan covers the 20% that Medicare doesn't pay for. The riders that are available are your Part A deductible rider. So if you're admitted to the hospital, you're not paying $1,484 this year. If you stay in the hospital longer than 60 days, you're not paying $371 per day. If you're in there longer than 91 days, you're not paying $742 per day. So the Part A deductible rider covers your in-hospital stay. Medicare supplement picks it up. The second rider is for home health. If you need help but don't want to go to a nursing home, but if you had home health, a home health nurse or that type of service, you're able to stay in your own home longer. Well, with original Medicare pays for 40 visits by home health per year. If you add the rider to that, it covers 365 visits per year. The next rider is Medicare Part B excess charges. And what that means is when Medicare pays a doctor, durable medical equipment company, pays for your labs, they pay the Medicare allowable rate. They pay a flat fee. Of course, some specialists, I've heard of durable medical equipment companies. They do have the option to charge up to 15% over that flat fee that Medicare pays. So with the rider, your wallet stays shut. You don't have to pay out of pocket any excess fees that are charged either by a physician or a durable medical equipment company. And then the fourth rider is foreign travel. Medicare is a US-based health plan program. You go outside the country, there is no coverage outside of the United States under original Medicare. So with the foreign travel benefit rider attached to your Medicare supplement or Medigap plan, you do have coverage for urgent care needs and emergency. They call it urgent or emergent needs. And it covers you within the first 60 days of your trip. Typically on the plans, there is a $250 deductible, and it's an 80-20 split. But if you go to Canada fishing, or you like to go to the Caribbean or Mexico to catch some sun in the wintertime, got a trip planned to Europe or wherever, it's good to have. Definitely will help in the case of an urgent care visit or an emergency room. Definitely recommend, if you have a trip planned, you want travel insurance, because that coverage won't get you home. It's not bringing you back to the United States from wherever you're at. What a Medicare supplement doesn't cover is things like routine dental, routine vision. Doesn't help pay for cleaning, 2 cleanings a year, and any cavities being filled, or root canals or crowns or any of that fun stuff. Doesn't help pay for your eye test or new glasses. Doesn't cover hearing, so yearly hearing check or um, uh, hearing aids if you need them. Original Medicare doesn't cover prescriptions, which is Part D of Medicare. So if you choose a Medicare supplement or Medigap plan and you take prescriptions, what we'll do is look at a prescription drug plan. So that would be a separate plan. It can be the same company that has your supplement. It can be a different company. It all depends on how your medicines fall into the formularies for the different providers of prescription drug plans. One of the biggest benefits of a Medigap or Medicare supplement plan is your freedom to choose where you go for your health care needs. There is no network. You do not have to get a referral to go to a specialist or to go out of network, because there is no network. You have a Medicare supplement plan or a Medigap plan, and you can go anywhere in the country. If you want to travel or be a snowbird, Florida, Arizona, South Texas, wherever, you don't have to worry about finding a doctor that'll accept your plan because you're covered under Medicare. The only criteria is the doctor and the facility have to accept Medicare. Well, that's 95% of doctors and 98% of facilities in the country accept Medicare. So it's actually harder to find one that doesn't take Medicare than it is to find one that does. It's also very good if something does develop and you want to go see a specialist at one of the more renowned research facilities in the country, whether it be Mayo Clinic or Johns Hopkins, wherever you want to go. You don't have to ask anybody. You find out what doctor's doing what and call and ask for an appointment. And you tell them, I'm on Medicare and have a supplement. So that's one of the best things about a supplement plan is total freedom to go where you want to go. The other avenue is what's called a Medicare Advantage plan. Medicare Advantage plans, if any of you are nearing the age of 65, you are probably getting bombarded by mail from plan companies. Medicare Advantage plans typically your monthly premium is lower than a Medicare supplement monthly premium. With a Medicare Advantage plan, you will have copays on pretty much everything you need done or want to do. So almost all plans have a copay for seeing your primary care physician. They have a little bit higher copay for seeing a specialist. If you're admitted to the hospital, many plans have a copay per day for days. Some are 1 through 5, others are 1 through 6, 1 through 7, and then no cost after that type of thing. So again, premiums are lower, but you're paying as you go. Labs, imaging, anything like that all have a copay. But they also, many plans have coverage for some routine dental. So you can get your 2 cleanings per year. They might even have some coverage, whether it's a 50-50 coverage for root canal or a crown, things like that. Many also have eyeglass coverage where they help you pay for eyeglasses every year and provide a vision test, cover a vision test for you on a yearly basis. Same thing with hearing. Most of them, a lot of them have a health facility. A lot of people hear about Silver Sneakers or Silver and Fit, those type of programs where if you join a Anytime Fitness, Planet Fitness, those type of places, the YMCA, they'll cover a basic membership for you at a fitness facility. And always makes sense because if people are going to go and use those facilities, typically they're healthier. So there is some great benefits to Medicare Advantage plans. Medicare Advantage plans they closely resemble group health plans. There are HMO, Medicare Advantage plans, Health Maintenance Organization, where you pretty much need to stay in network with their preset network providers. There are also what are called PPO type of plans, preferred provider organizations, where you get you have the option to see their in-network providers, or you can go to an out-of-network provider. But typically the out-of-network provider, your copays or a coinsurance is going to be higher than seeing a in-network provider. There are some other type of plans. They're called PFFS. Those type of plans are not sold very often. With a PFFS plan, you can pretty much see any doctor you want as long as they agree to it, because before you see them, you have to ask if they will accept this insurance and accept the balanced billing that the insurance company offers them. So with that type of plan, if you see a doctor one time, you get permission to see him one time, they do have the ability to say, no, I don't want to see you anymore because I don't like the way that billing worked out. So those plans aren't very popular. I've seen them work for people that travel all the time. If somebody is going to be motorhoming throughout the country, it's a plan that might fit their needs. Medicare Advantage, again, we covered pay as you go. So you're paying copays as you go. They do have networks, whether you have to stay in network. Some Medicare Advantage plans have travel benefits. So if you do decide to snowbird, they either have in-network doctors throughout the country, or or have a plan set up that lets you see doctors outside of the network for up to a certain time period within the year. So many months within the year, you can see doctors that are out of network and still be covered at a reasonable price. So with that, that pretty much wraps things up as far as the presentation. Just want to see if there's any, not seeing any questions as of yet. I will go back to my screen share and pull up my contact information. So I definitely thank you for attending today. Hopefully my contact information is coming across there on the screen fairly well. Again, my name is Stewart. I'm at Midwest Financial Group. My email, steve@mfgteam.com. And our phone number down here is area code 608-807-4775. I'll leave that up here for a bit and see if there are any questions that came through. I have recorded this presentation, and I will be getting the recording to Linda so that if anybody wasn't able to view it that wanted to, or has any questions about what I covered, it'll be a cloud-based recording so that you have the option to view it at any time that you'd like. And we'll drop that back down. I'll check one more time to see if there's anything in the questions, or I don't see anything in questions or answered. Again, if you have any questions, if you want to know more, if you want to discuss your individual situation, feel free to give me a call. There is no charge for my service. So yeah, when you give me a call, with the pandemic that's been going on, typically what I like to do is set up a Zoom meeting with people, get to know them, talk about their wants and needs as far as a Medicare plan coverage, whether it be a Medicare supplement, a Medicare Advantage plan. I am a broker, Medicare supplement, Medicare Advantage broker agent. What that means is I am appointed with all of the major companies across the country, also the local companies that offer Medicare plans, the prescription drug plans. And so if you have information about like your district plan, if you're looking to retire and you or your spouse is either already 65 or going to be turning 65, what we can do is kind of compare what the district plan covers and the cost, and then what it would cover to go on to Medicare, pay your Medicare Part B premium, and then have a Medicare plan associated with that. So with the district coverage, that's not Medicare coverage. So there's always the option to go to Medicare if you're 65, going to be 65 or already 65 and going forward. Again, don't charge anything. The only way my company gets paid is if we enroll you in a plan. So there's no fees to anybody for consultation, for advice, for anything like that. Also, working here at Midwest Financial Group, I am a salaried employee. So what that means is I don't have to worry about commissions being paid. There are many agents out there that sell Medicare, and they work on commission. So kind of take that as it may be, but I do not work on commission. I work to help you find a plan that meets your needs and your budget. So contact information, if anybody wasn't able to copy down when I had my contact information up, Linda does have my contact information. And the thing with Medicare is I need permission to contact you, and the only way to earn that permission is for you to contact me first. So if you'd like to talk further, please either give me a call or send me an email, and that gives me permission to talk to you. And it would be my pleasure and my honor to be able to help you on your Medicare journey as you go through. Again, if you have any questions and I didn't cover it here, please send me an email. Happy to answer any questions. And I definitely want to thank you for the opportunity to go over this with you today. And hopefully in the future, we'll be back to meeting more in face-to-face and getting to know each other that way. But stay safe and have a great rest of your day. Thank you very much.